Carpal tunnel syndrome, first of all, is a condition where you have less sensation going into your fingertips. You get numbness, tingling, and it's caused by inflammation in the tunnel that goes into your wrist, which is the carpus. So that's carpal tunnel syndrome. And it can be caused by numerous factors. Very common one is pregnancy, when you get increased fluid retention and swelling, and that causes more compression of the nerve going through the tunnel into the fingers. Also, hypothyroidism, rheumatoid arthritis, diabetes are also causes. I use a clinical examination and a history and physical. Of those, to me, the most important is the history. When you're talking to a patient and asking them when they're bothered by it. And usual things that you hear is that they wake up in the middle of the night, have to shake their hands for relief kind of thing, and it bothers them while driving. And you ask about the pattern of numbness and tingling. Is it all fingers? Is it just the thumb, index, and middle finger? Does it involve the small finger? And carpal tunnel should only involve the thumb, index, middle, and part of the ring finger. And that's how you kind of clue into the fact that this is probably carpal tunnel syndrome. But there are tests that you can do on your examination, and certainly a nerve conduction study is the best way objectively to see if there is slowing of the nerve through the carpal tunnel, and it gives you a number, a numerical number, to tell you if it's mild, moderate, or severe by the nerve tests. So I first and foremost see how the patient's bothered by it, and based on that, certainly if it's moderate or severe by the nerve test and your exam is very positive, then I would recommend doing an endoscopic carpal tunnel release, which is a minimally invasive release of the nerve. Prior to that, if it's mild and the nerve tests don't show that it's too significant, you can try a steroid injection. And almost always from the outset we'll try a brace at night to help patients sleep through the night as their initial form of therapy.